Now, PICO addresses other issues in the community. You address housing issues, safe community issues. How do you see healthcare intertwined with all those other issues? How does it affect it?
Healthcare, I think, is the linchpin. Unhealthy people can't work, which means that they probably can't afford houses. They probably can't take care of their children. They probably affects their children's health as far as going to school. And healthcare is the linchpin. It's the engine that drives everything. An unhealthy person really can't contribute to their society. You know? And so for us, healthcare is a priority. You know, that children need to be covered, our adults need to be covered, so they can really make a full and vital contribution to the society in which we live.
You've testified on Capitol Hill a number of times over the past couple of years. Could you characterize how you see the momentum for healthcare reform? Has it changed? Has it grown? Has it decreased?
I think it has remained the same. I think it's still a priority on the tables of many of our legislators. Right now we're in a presidential election, so of course that's going to be lifted up more. But most of our legislators feel that it's still a key piece, it's a very high priority thing to get done. Of course you're going to get some opposition along the way, but I believe that being from our position, PICO's position, we're going to make sure that that stays in the forefront. We're not going to let it drop down to the bottom as far as priorities are concerned.
And as you're trying to keep it on the forefront, are there some issues, looking at all the different stakeholders that are going to be involved in this debate? Some will have opposing positions. Are there issues that for PICO are just non-negotiable, things that have to be a part of healthcare reform that you would accept?
I think everyone who participates in the process, I think ultimately we want coverage for everybody. And people are going about it different ways. We just, from PICO's standpoint, we just want to make sure that some of the critical elements that we're looking at remain in there. It's not that it's non-negotiable, but and sometimes there can be a little tweaking here and there, but we don't want the key pieces of us removed completely, because then it's a bill that doesn't really make sense. So there are some things that are somewhat non-negotiable, okay, but at the same time, we understand that sometimes some tweaking does need to happen.
And those things would be, you said, covering everyone.
Covering everybody, making sure that it's affordable for all Americans, regardless of their income level, and making sure also that it doesn't really put a great stress on the national budget to the point where they start looking at it again and saying, we need to remove some of this funding and resources from health care coverage based upon them not really budgeting right. We want to make sure that it stays in that bracket, that everyone can afford it and that the government can maintain it, and that it's just there for everyone.
And looking ahead to 2009, are you hopeful that there will be momentum and true change from whoever our next president is and our congressional leaders?
Yes, we're very hopeful, and we want to make sure, again, one of our priorities from last year was dealing with the SCHIP, and so it runs out in March of 2009. So we want to make sure that that thrust keeps moving forward, you know, and that the bill that was there, it gets revisited and looked at. But we're hopeful that the candidates who get in office grab hold to this bull by the horns and take it to where it needs to go. We're very hopeful for that, yes.
Reverend Heyward Wiggins, thank you so much for joining us today on health08.org.
Okay, thank you, Jill.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.